Normally, dogs have 42 teeth and cats have 30. So let's say you look in your pet's mouth and you notice that one of them's missing. No big deal, right? Not necessarily. There are 4 possibilities for teeth when they're missing in the mouth, even if the overlying gingiva looks normal. We're going to discuss those one by one. This is an average dog's mouth from the side. What you can see here are the edge of the incisor teeth, the canines, the 4 premolars. There are 2 molars behind this on the top, but you generally can't see them without anesthesia. This is the side view of a normal cat mouth. Again, you have the incisors and the canine, and then you have 3 premolar teeth. The 1 molar tooth in a cat is so small it's usually not seen on a wake examination. This particular pet is missing its lower first premolar. If you notice, the gingiva looks completely normal. However, in order to determine if there's anything wrong, we need to take a dental radiograph. The first possibility for a quote-unquote missing tooth is that the pet was born without it. This is not uncommon in small breed dogs. If this is the case, the dental radiograph will reveal no evidence of a tooth. The second possibility for a missing tooth is that it was previously extracted or fell out on its own. This is rare in young dogs, but is very common in older dogs. If this is the case, you may or may not see evidence of a healing socket on your radiograph. The third possibility for a quote-unquote missing tooth is that the tooth was broken off, either during an extraction attempt or naturally by the pet. In this situation, what the dental radiograph will elucidate is a retained root tip. This retained root tip may be painful and is likely infected, and this requires therapy. In general, we recommend extraction of these retained root tips.
In this radiograph of a missing lower premolar, you can see the retained roots as shown by the blue arrows. You can also see the area of bone loss shown by the red arrow. This is proof that the root is infected.
Remember that these pets often show no outward clinical signs, and the gingiva overlying the retained root is often normal. The last possibility for a quote-unquote missing tooth is that the tooth never erupted. This is known as an impacted tooth. Impacted teeth are fairly common in brachiocephalic breeds. That means the pugs, the bulldogs, and the boxers. Typically, it's the lower first premolar,
which should be in the area shown by the blue arrow.
Unerupted or impacted teeth may or may not cause a problem. About 30 to 40% of unerupted teeth will form what's called a dentigerous cyst.
This is a dental radiograph of a large dentigerous cyst in the lower jaw of a dog. The circular black area is due to bone destruction from cyst expansion. The cyst was created by the impacted premolar tooth, which is shown by the white arrow.
As you can see, there are 4 possibilities for quote-unquote missing teeth. These are: the patient was born without it. 2, it was previously extracted or exfoliated. 3, the root was broken off, thus leaving a possibly painful and or infected tooth root behind. And 4, the tooth is impacted and may or may not have a dentigerous cyst. Out of those 4 possibilities, 2 of them are bad, and therefore I recommend dental radiographs of any missing tooth.